Welcome to another in our seminar series. Today's seminar is presented by Malini Sasidharan, and her presentation is on planning for mental health in Indian cities under climate uncertainty. Malini presents this as a critical thematic framework analysis of the 15-minute city and restorative urbanism, examining her applicability in Indian cities through the lens of climate vulnerability and social equity. Let's tell you a little bit about Malini. Malini is a researcher based in Kerala, India. She works at the intersection of urban planning, mental health, and climate justice. With years of community-engaged research experience across South Indian cities and a background in design thinking pedagogy, her work centers on the lived experiences of vulnerable communities by examining how caste, gender, and urban space shape mental health under conditions of climate uncertainty. She marries her expertise in co-design, participatory methods, interviews, ethnography, oral histories, and observation to conduct more ethical than extractive research to bring forward the voices of the most vulnerable. Malini holds a master's degree in public space design from Shriti Institute of Art, Design, and Technology, and has an undergraduate degree in civil engineering from Cochin University of Science and Technology. She has completed the climate-based, she was part of the Cohort 9, fellowship with distinctions, where she's been leading a collaborative project called Can Data Listen to Stories? And in that project, she interweaves climate narratives with quantitative data through pluralistic and artistic representations. Her work at the esteemed Institute of Quantitative Social Sciences, Salata Institute Research Cluster on Strengthening Communities continues to guide her in transformative, multidisciplinary research and greatly informs her practice. Her current work includes a critical framework analysis examining how existing urban mental health planning models are applicable in Indian cities and how the adaptation and awareness of climate change, policy gap analysis, looking at all of this through the lens of anticipatory grief across social groups in Kochi. A little bit about her fun side of Malini. Alongside her academic work, she's trained in Carnatic music. And I'm going to not get this word correctly, Nalini, but I'm going to try. Bharatanyam and Veena, and is now learning Mohiniyattam. She also explores digital illustration, abstract work, and other art media. She's fascinated by simultaneously occurring pluralities and singularities of human lived experiences and how community voices can be the most impactful anchor for advocacy, implementation, and awareness. Malini is dedicated to and excited about building knowledge and is co-produced that knowledge as it's co-produced with communities through care, not extracted from them, but reimagining cities for mental well-being and coexistence for all living forms on Global South reality's own terms. Malini, we look forward to hearing from you this morning. Welcome.
Thank you, Dr. Thomas. Thank you, Dr. Margot Thomas. And thank you, Mr. Bocanjo, for this opportunity. I feel very much happy and grateful for this opportunity. And I'm very excited to share my ongoing research here. This all started with the questions that I've been having to address through what I've seen in my life and what I've read through. So it is remarkable that I'm able to share this research here, and I hope that this will bring discussions, or this can start discussions about talking more about the intersection of planning, mental health, and climate change, especially when it comes to global south and specifically India. Um, So today I would like to talk about a critical analysis with a mix of um, thematic analysis that I've done with two very significant and famous frameworks that are restorative urbanism and 15-minute city in the planning designing sector. They are very useful. They have a lot of positives, and I've been studying that. I think all of the planners and designers must have studied about it and read about it at some point in their career. I'm looking at both of these framework from the lens of climate vulnerability and social equity, and how it is applicable or adaptable to a country like India. So before jumping into these frameworks, I would like to we can discuss about a bit about Indian urbanization and what is happening in India in terms of climate change, mental health, etc., without going into a lot of depth. So if you can see that India is growing every day in terms of population and also in terms of urbanization, increasing population. As of 2026, India has become the most populous country in the world, and then urban population is also increasing day by day. In the world, like 55% of people right now live in urban cities. And in India, around 377 million people live in urban cities in India. But the interesting thing about cities, especially in India, is that increasing population in urban cities is not directly proportional to the livability in terms of physical infrastructure, social facilities, healthcare systems, etc. Um, then India's urban development is increasingly should ideally rely on planning strategies, but what happens in reality is that planning, designing, and different policy department and other governmental institutions, they work in silos and not together. So that actually impacts and affects how the implementation happens on ground, even though the planning, all kinds of planning, spatial, economic, strategical, structural, everything, all the departments should ideally work together, but that happens very rarely in reality in India. And if you are talking about mental health, there is no unified policy for designing for mental health. I'm sure that many countries don't have that, but a country like India with such a diverse population, such a big number of population, and such big population density, it is high time to have a unified, not just for mental health, physical and well-being, but there are no unified policies where all the stakeholders work together for people's well-being, both physical and mental health. Um, and when we are talking about what is happening in terms of climate change, so India is, like we just mentioned, India is the most populous country in the world. India has an overarching framework called National Action Plan on Climate Change, NAPCC, serving as like it is the umbrella institution for all the climate change related initiatives and research and work that is happening in India. Um, and then India has been ranking among top 10 of the countries which are the most climate vulnerable for the last many years. I think last year it was sixth position, and this year it's in the seventh position. But India holds the record of the most affected people by extreme weather events in 2024, including a massive landslide that happened in my home state, where more than 300 casualties were there in less than 2 days. So India faces extreme events every single day. And as of April 2026, India has 95 of the 100 hottest cities in the world. And when we talk about see the climate heat change, we can see here that this is the temperature map, meteorological data from 2 consecutive days. And also you can see the maximum temperature, minimum temperature, and mean temperature. You can see that the maximum temperature and the minimum temperature is so extremely different. The maximum temperature reaches around 40 to 46 degrees Celsius in many cities and states in India. And what is interesting about and sad about climate change is that the impact is not the same across the sectors or across the population, which is true for any city and countries, but it's more prominent when it comes to developing cities uh, and countries. So if you look at that, there are several vulnerability factors. As we all know, it includes geography, physical environment, biological factors. Geography means where they reside. If it's a hilly terrain, there might be more chances for landslides. If they live near the river, there might be more chances for floods. Physical environment in terms of housing, city, etc., and the biological factors and health status, the care, the accessibility to healthcare, the biological and genetical factors, socio-political factor is a very interesting one in India because India has a very intricate and dangerous caste system that is still practiced even today, and that percolates to every single aspects of your life. And that aspect that percolates even into your socio-economic factors, health system, access to health system and capacity, and even gender and equity. A study by CEEW says that 17 out of 20 people in India are vulnerable to extreme hydrometeorological disasters, and 5 out of 20 are vulnerable to all the three extremes, which is not a small number. And still, we don't see many powerful and active institutions working to tackle the climate change impacts in people. And when we are talking about Indian mental health, India, 1 in 10 people have one in sorry, just 1 in 10 people experience some sort of mental illness. And again, the thing is very interesting here because mental health is a topic of stigma even today in India. And even the vocabulary to talk about mental health on to like confide in someone is extremely different across the population and your geographical location and social, political, economic factors. So this data might not be telling the true number of people with mental health and well-being issues. But even now, we know that 1 in 10 people in India experience some sort of mental health condition. And there is the primary policy or act that controls, or that is the mother of all the policies in that are relevant to mental health, is the Mental Health Care Act, MHSCA, which was passed in 2017. The act says that the country has the duty to support every citizen of the country in terms of mental health care, support system, and recovery, etc. It is true that there has been more initiatives and conversations happening at the government level, policy level, but it's very interesting that if you look at the economic aspect of it, the funds are still stagnated. And that is a very crucial issue because even though the conversations are happening, even though there are more initiatives, not enough fund are allocated in the union budgeting, which causes a lot of problem to implement many of the policies and initiatives. Um, and so recently, there was a study which consisted of 84 nations to look at the mental health and well-being of 84 countries, and India ranked 60 out of 84, which is not a very uh, good place to be. And another interesting or any significant aspect of mental health is that climate related mental health concerns are rapidly increasing across the population and age group, but particularly among youth. There are many studies that shows that young youth and young people and even adolescent children face more concerns and issues related to mental health, climate change, in terms of eco-anxiety, anticipatory grief, solastalgia, etc., because they feel that they are living in a place, there's a lot of uncertainty in terms of climate every day that we see on a daily basis. For example, right now I'm not in my house. I am in my friend's place for a workshop, and just yesterday, the house that I live in now, had a sink, like the land underneath the house in one portion just has gone down, and thankfully nobody's hurt. But then these kind of things are happening on a daily basis because of the monsoon. The land beneath the soil beneath the house on one part just eroded, and there is one big pit now. So these kind of issues were not known when maybe I was a child, but today's children and youth are facing that every day on a daily basis, and they are really worried about how to tackle this, and how to even change positively the condition. Again, when it comes to climate change and mental health and vulnerability factors, you can see that there are a lot of overlapping vulnerability factors: economic, environmental, biological, socio-political, healthcare and capacity, and gender and equity, geographical, etc. And again, when it comes to India, it's a bit different how it's said in other countries, or like especially in global north, because each and every aspect are tied up, and also caste and gender and religion percolates into every aspect of vulnerability factors. I've in person worked with people who are below poverty line, and most of them are minority and vulnerable caste and religious group. And now, when we are talking about mental health and climate change in India, we face, just like how I mentioned the example just now, we face disruption, disaster, and uncertainty on a daily basis. People experience different kinds of climate change in terms of not just disasters. It disrupts your daily life. For example, if it's flooded, you can't go to the work. From things like that to uh, big losses like losing your home. One day your home is not just there because a major life landslide happened. So these kind of things keep happening, and there's a lot of uncertainty. Like again, I'm sharing a personal experience from my life, because my parents' house got flooded in 2018, which was a very big flood in Kerala. Almost all the districts were flooded. And what happened was that since then, every year they face this anxiety towards the rain, towards the monsoon season, because they don't know if they'll have to relocate. There's a lot of uncertainty. They don't know after 10 years how the situation will be, because we live near the river. So will the land be submerged? There's a lot of land submerging happening in many coastal areas in Kerala. So all there are different kinds of impacts for climate change. It's not just one big event, but on a daily basis, there are a lot of changes, including increasing temperature, humidity, etc. And again, with climate change panel, and also with the mental health institutions, there is one prominent climate change and human health program, which is National Program on Climate Change and Mental Human Health. Under that, they do focus on mental health, but the thing is that there are no even distribution of the initiatives throughout the country. There are certain states that do well in terms of they create their own initiatives to support people in the wake of disasters, etc., or like provide continuous support for climate change related issues. But very few states do that. So the distribution of the implementation is very uneven. And there are certain guidelines when it comes to how to implement these disaster support, etc. But many of the data, how they are implemented, or the progress of it, or the monitoring and evaluation is still not um, available on public domain. And again, if we now we have seen how um, the vulnerability factors when it comes to mental health, climate change, like we discussed, all of these overlap a lot. And then the again, youth face more climate change, um, and then they have more induced illnesses. But the impact of these, again, I'm reiterating because it is very significant to what I'm trying to share today, what I'm trying to um, hold a space for all of us to discuss about it. I hope that we can discuss more about it, because the impact of climate change and the impact on mental health varies across population, and it's mostly the people do least damage get impacted the most. So we will go through the two frameworks now that I've studied and critically analyzed and thematically analyzed. So the first framework is restorative urbanism. I'm sure that all the planners and designers know about this framework, and it has become such a significant textbook and reference book for many people when it comes to studying the intersection of designing and mental health. So I came across restorative urbanism because I wanted to learn more about the theories and the contemporary theories and frameworks in planning and designing. So restorative urbanism was primarily coined in the book Restorative Cities by Dr. Rowe and McKay in 2021, and it's an evidence-based framework for designing for mental health and well-being. There are seven interconnected pillars. So they call it pillars. You can say that there are seven aspects to or approaches that will bring in a complete approach of a very um, accommodative city for very good mental health and well-being. There are like green city, which is having more nature-based solutions, more greenery in the city. Sensory cities that less noise pollution, or the sensory enhancing city, or playable for especially not just for kids, for adults also. How you can incorporate the element of play into the city, and also inclusive city, where the city is accessible and inclusive to all the people from all the genders, people with disability, anything. And from this framework is why I chose this framework is that this focuses on attention restoration theory and stress reduction theory, because these two theories are quite important when it comes to learning how spaces can impact people's well-being. Attention restoration theory focuses on the cognitive aspects, and then how your brain calms down when you are in a calming environment, to say it very lame in layman terms, because I am not a psychologist. But from what I've learned, stress reduction theory more works on physiological levels, because it studies how your body reacts when you're in a calming environment. Both of these are like very, very significant, and it has been the foundation for many frameworks and approaches for designing for health, like therapeutic landscapes, restorative urbanism. So if you look at that way, restorative urbanism becomes the umbrella framework, which has multiple approaches incorporated together, and they have come up with one design, or one place, or one reference for all these approaches. And this is a very useful framework to start with when if you are confused about how you want to go about planning a city or designing a city for mental health, better mental health. But for me as an Indian, when I read and learned about this framework, there were a lot of questions that kept happening, and that's how I started studying it, because there are a lot. I saw a lot of key assumptions which are assumptions in the context of India, because there is this assumption that yes, nature-based solutions are great for your mental health. The assumption is that nature is universally restorative, but that becomes very tricky when it comes to extreme climate changes happening in India. Uh, um, I am a person who likes walking out. I like spending time outdoors, parks, but it becomes very tricky to be outdoors, and nature becomes actually not restorative in the times of extreme weathers. For example, if it's a heat wave, you can't be outside. Being outside is dangerous to your health. And then if it's flooding, you can't really go out, and it becomes you. The framework says that if you're for example, framework says that if you live near a water body, it improves your mental health, which is true. But if you live near a water body under the climate uncertain times, it becomes a very anxious thing for you, because you never know when the climate change is going to impact you from the flooding. And it also assumes that there is enough land available and the population density is more or less uniform, which is very different in India. First of all, India, like we discussed before, India is the most populous country in the world, and land availability is changing a lot. Not just for outdoor spaces and parks, that is also shrinking a lot, but even for the basic things like housing, land availability is reducing drastically every year. So this assumption that land is available and population density is uniform, which it is not applicable when it comes to India. And then also the book says that book is like derived, the framework's derived from a uh, lot of research papers, lot of researchers work and with their own research throughout that happened throughout many years. But it is, even though it says it is universally transferable across contexts, um, it I we have to think if it can be just transferred just like as it is to different contexts. Another key assumption is that availability of natural resource and electricity. This is a very relevant one when it comes to India, because India, there is one example or one pillar to the framework where it says that if it's a hot day, we can install like sprinkler foundations or other water methods to cool down the people or cool down the environment, which is, or even like using electricity, which is very strenuous when it comes to India. We'll talk more about why this is more strenuous in India. And also the framework doesn't talk much about how it can be implemented, how in the ground on the ground level in a country like India, and how these design elements can be transformed or translated into policies across the stakeholders and governmental institutions. And to an extent, it also assumes that you have individual agency and access. In India, the access and agency to even to access a park depends on your gender, caste, and several other socio-economic and political factors and gender factors. So it is very the access or the availability doesn't guarantee access, and just because it's something there doesn't mean that you will have agency to access it. And when we're talking about India's climate perspective, India faces extreme climate such as heat waves and floods. So in when you're looking at the framework, it becomes really difficult to be outdoors, especially when it comes to nature-based solutions, because it actually becomes dangerous to your health to be outdoors. And it's very resource intensive and high maintenance approaches that may prove environmentally and contextually unsuitable. This is what we discussed before in terms of fountain heads and sprinkler heads to cool down the environment, because India has 5 cities which are the most water scarce in the top 20 cities in the world. So and electricity also, in terms of in the context of climate change, there are more power outages and more shortage of electricity. So all these solutions becomes tricky to be implemented in India, because all these are like uh, resource intensive and high maintenance. And then also, um, in the context of climate change, nature turned from therapeutic to threatening, because you feel an uncertainty towards the nature itself. And like you were discussing, um, in Indian context, there are a lot of daily wage laborers, street vendors, domestic workers. All of these can impact. These people might not have to even access the public space when they need, or retreat from outdoor spaces when it is required in terms of climate extremes. So all these impact the framework implementation in India. And also, in terms of vocabulary, there are different kinds of urban vocabulary that exist in India might not be might not be existing in global North urbanism. So I think we'll have to come up with a different vocabulary altogether. Let's look at the second framework. Second framework is that 15-minute city. 15-minute city was developed by or framed by Dr. Moreno. It is based on chrono-urbanism. It says that the quality of life is inversely proportional to the time you spend on commuting, especially through with the use of automobile. Um, and then the framework says that all the basic amenities, entertainment facilities, and services should be available within 15 minutes on foot or by bicycle. It also says that it will have a lot of benefits for your health, which will improve your quality of life, and it can also significantly reduce car dependency, which is also great for the environmental sustainability. This gained a lot of significance when we were living during pandemic, because there was limited mobility, and then people started rethinking how we can look at a city from a very macro scale to a micro city scale. The framework says that you must have access to your um housing, work, commerce, education, health, and entertainment, all these facilities within 15 minutes of uh, walking. So the key assumptions when we are talking about this framework are that the framework assumes that proximity enables accessibility, which need not be true, even in terms of, if, for example, if you have a physical concern, you may not be able to access just because it's near to you. And then it also assumes that there are like consistency in urban facilities and density. And it also does not talk about the behavioral aspect and proximity, how we can actually change the behavioral aspect of people to encourage people to walk more. It's also not discussed a lot when it comes to the framework. And also, it says that it mentions the universal transferability, which also might not be true in all the cases. And if you're looking at from India's climate perspective, um, there are certain things that the analysis brought out, that the climate change fundamentally alters being outdoors in India, because it requires enormous social, economic, capital policy changes and behavioral shifts for the cities in India to become the major cities in India to become 15-minute cities. Because one example is that the time of commute, the traffic and road capacity, everything is different when it in India. And then India experience exceeding temperatures like 45 degrees Celsius during summer months. There are most of the states face climate extremes during summer, and most of the states have floods. And right now there are a lot of states who are facing flood issues. And um, and all of these are very relevant because in Indian context, uh, basic urban infrastructure, housing, sidewalks are very, very less. The quality of basic infrastructure is very less. India is one of the least walkable. India has a lot of cities which are the most least walkable cities in the world. The work-life balance, accommodation of cultural heterogeneity across cities, across and states, and the framework also doesn't address land use patterns. When it comes to work-life balance, for example, in a city like Bangalore, the average commute for a person from their housing to work is 42 to 45 minutes one way on a daily basis. So, without changing the systemic things, there is no way that we can accommodate the framework of 15-minute city in large cities like India. It also assumes that the population density is uniform, which is far true from in India. And also India is one of the most dense populous country. It has 382 the population density is 382 per square kilometer. And the framework also assumes that there is enough connectivity in terms of Wi-Fi and all other internet, but India still has a lot of digital divide, and that is also impacted by the caste, gender, and age. So after discussing all these, the critical thematic analysis was done, and then there were certain themes that emerged out of this research. The first one is that both the frameworks, to a certain extent, to a very good extent, assumes environmental stability, which has become far from truth in case of India and many countries. And which the that's in instability is more prominent when it comes to global south countries. um, it becomes threatening to be outside in the rain to your life. It becomes threatening to be outdoors to your life during the summer. So during the climate extremes, when the environment is not stable anymore, the assumption of environmental stability becomes very dangerous, and we might need a different approach. The theme too is that nature as paradox, because this is more of a behavioral aspect to it. When with environmental stability comes an ambivalent approach towards nature. It almost becomes like necessary, but also like dangerous at the same time. And it might not look dangerous every single day, but then there are still a lot of climate change related deaths happening on a daily basis across India. And the third theme is that differences in baseline infrastructure. Uh, so both the frameworks, the primary research was done in global north. The research was absorbed and derived from the researches that were done in global north, and it is a very different case when it comes to India. India has very different baseline infrastructure in terms of housing, pavement, electricity, all other physical and social and healthcare infrastructure. The fourth theme was that nuanced and deep-rooted social hierarchies. It is adjacent to racism, but then it is more deep-rooted than racism in India because it is internal. It happens among the people in the country even today. I would like to quote B.R. Ambedkar, who is a visionary from India. He said in early 1940s that India has two identities now. Once we got the freedom, that Indian people have a social identity and a political identity. Political identity offers constitution, secular rights, rights to speech, etc. And then Indians also have a social identity, which is still deep rooted in caste, um, uh, religion, etc. And the sad part is that it is very true even today. So, India, the nuanced, deep rooted social hierarchies need to be studied, and then the vocabulary itself is very different when it comes to addressing these issues. So, here is a flow chart of the study that has been done. There are two frameworks that have been studied. The research is planned to study two more frameworks, and then these are the themes that emerged out of it. This is the pictorial representation of the research that has been done till now. So after all these analysis and theme development, the discussion is around how can we adapt, or can we adapt these these two frameworks in India. The answer is not no. never know, because both these frameworks offer a lot of rich insights when it comes to developing or redeveloping or even retrofitting cities in India. Uh, the research concludes that it is neither activation nor adaptation, but it is likely to be an in between. But with the research suggests that an in between space with right based approach and right to research. This right based approach especially is very relevant when it comes, is becoming more and more relevant every year, but also it's becoming more relevant when it comes to co-production in mental health research or health related research. So I think when we are talking about an intersection of planning, mental health, and climate change, the right based research, right to research, that everybody can research and everybody can contribute to research becomes very pivotal to adapting or finding the in-betweens to implement these frameworks. But also at the same time, we have to ask certain questions like whose knowledge counts? How do frameworks engage in India's complex social stratifications? And can the dual expertise, for example, vulnerable populations have dual expertise. They have their traditional knowledge system also, but now they have the contemporary expertise, because this is like expert by experience. They are experts by experience, so they have a dual expertise. So can we actually use that, and can we actually center that when in developing or developing the in-betweens to plan Indian cities for better mental health? uh, so through all my research, I want to keep repeating and resonating that it is not that difficult if we all are together, if the research is at the center of the community, with the community, for the community, and if community itself does research, and if they have the right to research. I would like to share a tangential but very relevant example from Kerala. This is a play group, a play drama that started in India, in Kerala. So a couple of theater artists started thinking about doing scripting and writing and developing a drama about floods or the coastal issues that people in a small town in Kochi, the people that face there. And they started talking to the people there. And that's how some of the artists got an idea that maybe we can ask them to, like, consult them to write, not just consult them to write, but ask them to write, develop the stories, and also maybe we can ask them to participate in the drama as actors. So initially, most of the people in the village are fisher folk, and most of them were very not sure if, because they were not sure if they were actors. But since it was their story, they started performing. They developed the drama play, and then they started uh, performing it in different places in the surrounding villages. What happened next was really amazing and beautiful, because in nearby villages people also started resonating with the play a lot. And then they started going not just in Kerala, they started traveling in different parts of India, like Mumbai, Delhi, wherever the fisher community people live. And from all there, they started discussing their issues through a simple but very powerful play. So this shows that when the community is at the center, when the community is given agency, when the community is aware, we can. There's a lot that can be done. So the next stage in terms of the research, I'd like to compare and contrast to develop different diverse outputs. For example, 15-minute city, even though I spoke about how the adaptability of it in India, India itself is a very big country. It has different kinds of geographical terrains, different climatic zones. So it is only sensible to do city-wise analysis, which is the third point, and also compare and contrast how these frameworks are adaptable in different cities. For example, what I've observed when I've lived with my parents for the last few months is that I live in a small town, but if you look at it not from a Western or like global North perspective, it is actually a 15-minute city. It might not look like how they have envisioned, but the vocabulary is a bit questionable, but the proximity is there. All the amenities are available in the 15 or 20-minute walkable distance. The quality of the amenities, everything depends, but still, so I think we'll have to keep the vocabulary aside, and then maybe even come up with a set of new lexicons to address how we can still refer to these frameworks, which offer a lot of great insights, and then come up with a um, an Indian framework, or contextually, not just Indian, contextually specific frameworks for each city. And then the next stage will also be done through analyzing more and more frameworks like biophilic design, therapeutic landscape design, etc. So this is the research that has been done till now. You can find all the references here. Um I once again would like to thank Dr. Yonette, Dr. Margot, and Mr. Joseph for this opportunity. I am ending my discussion here. I hope that there'll be more people who are interested to discuss about this. Thank you. If you'd like to discuss more about this, please feel free to reach out to me. Thank you.
Thank you, Malini. I apologize. I was trying to find my camera. That was very engaging and so much to unpack. And oftentimes, I'll begin with the focus on the 15-minute city. Oftentimes, and I've been in discussions with Moreno and colleagues and those people who talk about the 15-minute city, it was designed for a northern, a European setting. And often the question is, how do we adapt it to other cities, other geographical contexts, and to make it relevant, right? What you've done is exactly that. How does that look? And I really like the fact that you said, well, in fact, when you look at Kerala or the particular city, um, it is a 15-minute city in that
Yes.
context. Um, so it is important, and I think your work is going to help other researchers like yourself in the in other contexts, geographic contexts, to look at their cities and not say, well, we can't use that same framework or approach. We can use the idea, but in our context, this is what that looked like, because the principles you're looking for are walkability, accessibility, um, and all of that. I also like how you overlay the whole notion of a therapeutic nature and how
Mm.
nature so there's the 15-minute city, there's one. And I like your linking them in the Venn diagram style. But I also am intrigued with this notion that you have that nature is moving from therapeutic to threatening because of climate changes in certain localities.
Yeah.
So those two things, I'd like you to talk a little bit more about the yes, you shaped the adapting the 15-minute city context, but talk a little bit more, unpack that a little bit more, and why that's critical. That's one. And then let's talk about therapeutic to threatening and what that means in the context of climate. While you do that, we have Helena Michoud in the audience. I'd like to invite her to join the stage and offer any questions or comments that she might have. Go ahead. Over to you, Malini, for those two. Yeah.
Thank you. So the adaptability of 15-minute city is very interesting that way. Like, I think we get stuck on the usage of certain words, and then it happens a lot, especially in the practitioners in India or in India. I've seen this. I've read a few papers where people just like mirrored the 15-minute city approach. But then what happens in
I
India,
think your
I think
microphone is reacting to your hand movement. So it's a little fuzzy, but go ahead, continue speaking. Just want to alert you to that.
okay, I'll just try to
There it is.
mute
It's
it.
perfect now. Yes. Yes. And if you bring your
Can
camera
you hear
down
me
a
now?
little bit. Yes, better.
Yeah.
Yes.
So it's the adaptability of 15-minute city. Again, I think we have to keep the idea that we are just absorbing certain framework, and we should just start looking at maybe we should keep the framework aside, then we should learn the context and place first. I think that will be a good approach to use 15-minute city, because it's a very good framework for improving the quality of life, for improving the environmental sustainability. But maybe if we start from the place, study the place, like look at the place basedness, and then then we go back to 15-minute city, and what are the amenities that the city asks to or like suggest to be implemented. That's one way to look at it. And uh, and again, I think in India, when it comes to, it's more important even for Indians to realize that there are certain elements of tier 1, tier 2 cities, tier 2 cities and towns especially, which can be adapted to bigger cities in India.
Yeah.
Because you say that it's a small town, but then is small town actually bad? Like, what are the
Yeah.
amenities there? Is the quality of life better? Not in
Yeah.
terms of slowness, not in terms of just nature, but is the quality of life better? So that's one way to look at it. And there also, I think I keep coming back to this, because you can just learn the lived experiences of people in
Mhm.
towns and small cities. That can be one way. I'm not sure if I answered your
Yeah, yeah, you
question.
are. It's a work in progress.
Yeah.
And let's talk about this movement from the threatening environment. And you talked a lot about it's good to live by the water. It's good to be able to have access those good things in the environment. But with climate change, it's becoming more of a threat in certain areas. Let's talk a little bit more moving from therapeutic to
Yes.
threatening.
Yes,
Yes.
so I will talk a bit more about what the frameworks mentions. For example,
Yes.
it has a pillar called green city, where if you live among the nature, it's good. We all know this. It has been like well researched and documented and spoken about, and it has been implemented also in many parts of the world. That's one aspect. The second aspect is blue city. The second pillar is a blue city, where it says that
The
if
blue
you live
city.
or if you
Yes.
have access to a certain body of water, it improves your mental health. It says
Hmm.
that even the sight of water body improves your mental health.
Hmm.
But then, if you're talking about green spaces, uh, 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 there are times where I can't step out into a park in my hometown because it's that hot. It's actually dangerous in India because there are thousands of heat deaths every year because of heat waves. So even and if you combine 15 minutes city also, like even being outdoors, walking 15 minutes outside during the peak summers when the temperature is so high might be actually threatening to your health, and so that becomes a huge problem. And then uh, and then when you talk about river bodies, like the there are a lot of rivers in India, and especially if you're talking about Kerala, Kerala is a small state. It has a lot of rivers, but it has more than 42 dams, which is being built in a certain state, and that this impacts the natural flow of the river, the flooding that increases due to these systemic changes and so even though water is good for your health, because of climate change, the access, the uncertainty or the threatening aspect that it might get flooded, the landslides might happen, the submerging might happen if you live near the sea. So all these things cause anxiety than therapeutic elements, and can contribute to your anxiety and mental distress when you live near the water. These are the few examples, because if you look at India, there are several coastal areas that are getting flooded every year, or even like during high tides, etc. There are people who are getting relocated because of the global warming and the sea level rise. And then there are people who are it's not just the behavioral aspects that's getting impacted or the life, it's also impacting the economy. It impacts the real estate. So it is a very layered impacts that's happening when you talk about, especially in terms of water body. Yes, these are the few
Okay.
examples.
Yeah, very, very important. Hello, Helena, Dr. Mishu. Thank you for joining us. Um, I'm going to, I assume you have a question or a comment, and I'm going to, before I continue with mine, allow you space to voice those.
Oh, thank you. Thank you very much. Can you hear me?
Very well. Yes.
Thank you. Fascinating presentation. And I think it really shows us the complexity of really addressing many of these issues, particularly with mental health and climate change, as an impact on mental health. And I guess I would ask, particularly since India is such a large country, and you've got, as you mentioned, age differences, you've got caste differences, you've got religious differences. When you think about it, are there particular communities that you would like to prioritize and try some of these, or thinking about some of these interventions at first? And if that's the case, are there kind of on the ground practical, maybe one or two practical interventions from the community level you might suggest? And also, if you have any suggestions, again, prioritizing on the policy level about dealing with some of these issues. And, again, you can, choose, be it rural, be it more urban, because I realize that they're going to be different, but things that you would be thinking about prioritizing for the community, from the community level, and prioritizing on a policy level. I have to say, I really like the aspect of the bringing in the arts to really deal with some of these issues, and drama and plays. This is the way people learn and can really feel connected. So I really like that aspect. And thank you so much for this wonderful presentation.
Thank you, Dr. Mitchell. Thank you so much. Yes, so is my audio clear?
Audio is a little fuzzy.
Mhm.
It's quite fuzzy, Malini. And I
Yeah.
think maybe you're moving around quite a bit, so it may be
Okay.
affecting it. So if you can stabilize it, that would be. Try this.
Okay.
There it is. It's perfect. So don't move.
Mhm.
Yeah,
Okay.
just keep it that way. Just talk. Okay.
Yes. I'm so sorry for the technical glitches. Again, the internet is also having issues because we are having heavy monsoons and many districts are like flooded here.
Yes.
Yes. So, Dr. Mitchell, thank you for your feedback. And yes, so again, the priorities can be different when it comes to like different places, but also one community level priority that I would say is at the local municipality level. We have seen a lot of work that happens, which is a lot of impact. Prioritizing the local body, like meetings, like including community in planning, and then not just spatial planning in terms of social infrastructure planning, social planning, economic planning. I would say that having a regular space to meet and then talk about not just the elected body members, but particularly talk including common people. Um, Start from awareness, because what happens is that in community level, many people, even though they know that climate change is happening, climate change is impacting mental health, there is no space to impact or impart awareness, because only when awareness is there, advocacy can happen. Only if there is space for advocacy, then agency can happen. So I will say that start from like spaces to meet on a daily or a monthly basis to raise awareness about the issues that are happening, because on a daily basis, we know climate change is there, we are experiencing it, but common people need to find food and then like find income. So they can't actually, they don't have space to think about how we can adapt or mitigate to this. But then often, since these people have the biggest lived experiences, they can contribute to a lot. So including these people at the community level would be a very good idea for people to start from awareness, go to advocacy, and then also that can actually result in agency, I might say. And then at policy level, what I see a lot in India is that there are policies getting implemented, but there is very less talk in between stakeholders or departments, especially when it comes to governmental institutions. Even if you look at the public physical infrastructure, road department works separately, irrigation separately, water department works even in water, like the irrigation and water works separately. So all of there's no communication and conversation that's happening, or the interdisciplinarity is not at all there when it comes to governmental institutions. So that is the starting point, because if there is no conversation, you might not know how you can support each other. So implementing policies which can bring together different governmental institutions can be a very good first step.
Thank you.
Excellent. Excellent. Well, Helena, thank you. You covered, because I was going to go back to, so what is the policy action that needs to happen and how do we implement? And I recognize that Malini is an academic and not a policy influencer. However, we in that academic space have to find ways of engaging the people at the municipal level in particular, because the more awareness they have, the more that we can infuse how these things work and get them to step back and look at this. It makes a difference in moving the needle towards policy action, informed policy action.
Yes.
Yes. I know that you are writing about this stuff and continue to do so, and mostly in planning and urban design. Again, within our academic space, we tend to be a little siloed, because when we're talking about mental health, the mental health people are over here. Well, what does that have to do with city design, and what does that have to do with water and accessibility and all those things? But they're inexorably bound up, and so this is the struggle. This is why seminars and organized seminars like this are so critical, bringing in the multiplicity of perspectives to help us to think collectively and create some action and impact. So I want to thank you for this amazing and, as Helena said, insightful presentation. And I'm hoping that we can figure out ways to carry this forward and to help amplify your work. I think critically looking at, that's why they call India a subcontinent, because it's a very large geography, and different cities, even cities within counties are different, and provinces. So whether you're on the Deccan Plateau or you're over on the Bengali side, or you're very different. So or northern Darudin and those areas, they have different impacts. But the monsoons and climate is impacting across the board. So I'm hoping that we can. Yes.
Maybe one thing that could help to incorporate collaboration is, because in all the aspects, the more the siloed are, everything impacts common people. Common
Yes.
people is impacted by everything. So
Yeah.
if common people, the citizens are the threat, and if informed participation and informed policy making happens, I think if people are treated as the common thread to all the departments, I think it will be a good solution. Because if we have more data on how people face, mitigate, adapt to all these changes, and how they get impacted mentally, physically in terms of climate change, I think it might be a good start.
Yes, and people are aware. We often have the assumption that people are not aware. There's some awareness that needs to happen. But your example with the drama group, they're an efficient community. So they're saying through this is what's happening to us, and they're using play, drama to articulate that. So they are aware, and they're trying to figure it out. So it continues. It's a work in progress, and I'm very for continuing this kind of discussion and dialogue and figuring out how we can greatly inform through different dissemination opportunities and engagement, or broader communities, and include community in the action, because communities make a difference at the municipal level and at the national level.
They can.
Well, we can see from the cockroach revolution activities that are happening. People have voice.
And that actually talks about the relevance of working with people, and there is another movement happening, which is anti-reservation movement, because even though caste and because we have caste reservation here in education system, because this actually points out the relevance of this kind of work, community-based research and participatory research work.
Yes, absolutely. So lots of additional work to be done, and more food for thought, and we'll continue this dialogue and focus. And I'm so happy to be able to advance this in some measure. So
thank you so much.
Thank you so much for this presentation, Helena. Thank you for participating. And we will continue to be continued. Yes. Okay. Excellent.
Take care.
Thank you so much, both of you.
Bye-bye.
Take care. Okay. Bye-bye.